Good morning. Let me introduce myself. I am Stefania La Grutta, Research Director at the CNR, Institute of Translational Pharmacology in Palermo, partner of the CLIC project. Today, on behalf of the team of researchers composed by Velia Malizia, Giacomo Ilardo, Omar Shatarat, and Anna Bonomolo, in the next 25 minutes, I will present to you some aspects of the topic climate adaptation through fostering perspective in urban planning. To facilitate understanding, I will first present the outline of this presentation, which includes 4 points. We will start with the first point: climate and health, evidence and effects of climate change on health. In November 2022, the Lancet Journal further called for urgent action to protect health in the face of the ever more pressing danger of global heating. Indeed, the following points must be considered: the accelerating collapse of some of the most important planetary systems underpinning human survival. The Antarctic ice shelf has contracted by almost 2% since 1997. Therefore, loss and thinning could lead to substantial sea level rises. Climate change is causing rapid acidification of the Arctic Ocean, risking long-lasting damage to the region's ecology. Climate effects are endangering the ability of forests to mitigate adverse atmospheric changes, especially in Amazon and North America. As we know, forest resilience is declining, with a halving of tree life expectancies in some regions. The world is edging closer to multiple tipping points that, once crossed, will drive the temperature change well above the 2 degrees Celsius. Therefore, considering all these aspects, the key conclusion of these results is that our current actions are insufficient to limit warming to the Paris target of 1.5 Celsius. Indeed, this slide shows how the extent to which current and future generations will experience a hotter and different world depends on our current and short-term choices. Future emission scenarios up to the year 2100 show, above all, a significant and dangerous increase in high and very high temperatures. Faced with such multiple risks, it is necessary to be able to activate a complex response. An example of this type of response is the one that was activated in the face of multiple risks related to the COVID-19 pandemic, the impacts of which require the simultaneous deployment of adaptation and resilience actions, mitigation actions, and governance and funding actions. This slide shows an illustrative picture of the impacts of climate change. As you can see, they are divided in 4 main impacts: weather climate forcing, which concerns meteorological aspects such as rising temperatures, heat waves, precipitation, extreme rainfall events, cyclones and storms, and aridity. Physical impacts, which refer to impacts on environmental elements such as increase in sea surface area, melting of glaciers, reduction in snow cover, rise in sea level, change in river flow, and increase in lake temperature. Impact on natural resources, affecting numerous aspects such as biodiversity and ecosystems, water resources and soil, and finally, impacts on society and the economy, which include not only agriculture, tourism, forests, fisheries, infrastructure, and energy, but also health. Concerning health impacts affecting all age groups, here they are in more detail: heat wave-related illnesses, mental health and neurological diseases, malnutrition, allergies, cardiovascular diseases, stroke and other chronic conditions, infectious diseases, respiratory illnesses and asthma, injuries, zoonotic, vector-borne, and waterborne diseases. Let us move on to the second point of this presentation, which concerns in more detail the health effects of climate change, including mortality. The current evidence in climate change and health effects is summarized in an overview of systematic reviews concerning 94 reviews with at least 1 health outcome related to climate change. 10 health outcomes: mortality, infectious diseases, cardiovascular, respiratory and neurological diseases, nutrition, food availability and quantity. Climate impacts: weather variables, extreme events, floods, drought, cyclones, hurricanes, air pollution, increased use of health services, and vulnerable subgroups. This graph shows the frequency of climate change impact studies by health outcome, and we can see that among the health outcomes, infectious diseases are the most frequent, followed by mortality and cardiovascular and respiratory diseases. In a global context, it is necessary to consider the anthropogenic contribution to climate change and the impact in terms of the change of the fraction of mortality attributable to heat. The graph shows the increase in heat-related mortality over the period from 1991 to 2018 due to climate change. It shows that Europe and the Mediterranean are among the areas most at risk. In particular, in Italy, 30% of heat-related mortality is caused by anthropogenic climate change. Still in a global context, we have these graphs showing future impacts deriving from climate change with regard to the relationship between temperature and mortality effects. Here we can observe a positive trend in the two graphs circled in red, with an increase in excess mortality due to heat and a reduction in mortality associated with cold. And again, the Mediterranean is among the areas at greatest risk. In 2020, the European Commission has released an important technical document on global warming and human impacts of heat and cold extremes in the EU, focusing on all the health effects of extreme events which, as we know, are increasingly frequent and disastrous. Some aspects of this report were further detailed in the document Impact on Human Health in the EU and UK, which gives figures on future scenarios of expected mortality per year in relation to the 1.5, 2, and 3 Celsius degrees increase, estimated respectively at 29,000, 49,000, and 90,000 deaths per year. At the European level, these graphs show future impacts according to climate change scenarios, taking into account changes in temperature effects, hot and cold, on mortality. The graph on the left shows the changes in temperature impact on mortality under different climate change scenarios for a period that goes from 2070 to 2099. And we observe that the Mediterranean is among the areas at greatest risk, with Italy at 987%. As for Italy, this graph shows the effects of extreme temperatures on mortality by cause. The data are the result of Italian projects coordinated by the National Research Council of Italy. In particular, the data was collected in each province, time series by municipality, with daily count of deaths as outcome, municipality daily average temperature as exposure, daily confounders such as time trends, day of the week, flu epidemics, summer holiday season, etc. And the analysis were conducted by cause of death, age, ranging 0 to 74 and 75 plus, gender and type of municipality, urban, suburban, and rural. The curve on the right shows an increased steepening of the red curve, i.e. mortality, which refers to the increase in hot temperature from the 75th percentile to the 97th percentile. This last graph shows again, with reference to Italy, the estimates of the effects of temperature on mortality by cause. For cold, in blue, significant increase is observed in the relative risk of mortality of cardiovascular and ischemic diseases and diabetes. And for hot, in red, significant increase is observed in relative risk of mortality for many health outcomes, such as cardiovascular and respiratory diseases, cardiac and cerebrovascular, nervous and mental illnesses, metabolic diseases, and diabetes, as well as for natural causes. Climate change closely interacts with other environmental conditions, such as air pollution and urban greenery. In this diagram, we can see the effects of air pollution and climate change on health and how green spaces can act to mitigate them. In particular, green spaces can have effects on individual health, physical health, and well-being. Among this, it is important to emphasize the beneficial effects on a healthy lifestyle and mental state, as well as on physical fitness. In this slide, we can see the interaction between environmental pollution by PM 2.5 particulate matter and ozone and temperatures. In the graph on the left, we can observe the percentage change in mortality risk from heat exposure by pollution levels in Europe, which is significantly higher for particulate matter than for ozone, compared to all the other nations considered. With regard to Italy, the map on the right shows the different color intensities and shows the annual average temperatures. The southern area is the most intensely colored, which is equivalent to higher average temperatures, while for annual average ozone and annual average PM 2.5, the Po Valley, which is in the north, appears to be the most intensely colored. That means that is the area with the greatest percentage change in mortality risk from heat exposure by pollution levels. The environmental pollution in cities is a crucial problem. It has been estimated that by 2050, more than 70% of the world's population will live in urban environments. Some of the negative effects of the urban environment are mentioned here: crowding, transport, air pollution, urban heat islands, noise, lack of green spaces, high stress levels, and limited social interaction. Let us now move on to the third point of this presentation, which relates to adaptation and mitigation, the role of public health, where we are, and what we can do. The European Union has launched a mitigation policy plan called the European Green Deal in order to activate climate change mitigation, building and renovation, and sustainable industry actions. It is noteworthy that currently climate change adaptation policies are active with national health plans only in 3 countries in the EU: Sweden, Finland, and Ireland. But how can we respond to climate change? What actions can we activate? Basically, 2 actions are necessary: operating in a synchronous and complementary manner, mitigation actions with emission reductions, and adaptation and resilience actions, as you can see simply drawn in this picture. The 6th report of 2022 of the Intergovernmental Panel on Climate Change, IPCC, summarizes in this table the solution spaces and climate resilient development pathways it suggests. With regard to health systems and solution spaces, it indicates the different modalities, all while taking into account 3 important risk factors: environmental factors, socioeconomic factors, and susceptibility. In particular, it mentions the National Heatwave Warning Information System, national programs for the management of environmental determinants of health, disaster risk reduction and environmental disaster management, collaboration with civil society and other national security sectors such as civil protection, and the governance of national and local health authorities. This conceptual framework shows health mitigation and co-benefits interventions. I would like to draw your attention to the relevance of exposure to green spaces, which provides, and this is proven, reduction effects in all causes of mortality from cardiovascular and respiratory diseases, and a reduction in health outcomes such as mental health or reproductive health. This slide shows an example of a co-benefit of policy intervention related to urban transport. The result of the study refers to a scenario in urban transport in 2040 compared to the baseline of 2012 in Sao Paulo, Brazil. And they are that active transport was reduced in private car and motorbike use. Greater co-benefit in women was associated with increased physical activity, while reductions are observed for motorbike accidents and air pollution, which also greater benefits men. Effects are expressed in DALI, Disability Adjusted Life Year. The sum of the years of life lost to premature mortality, YLLS, and the years lived with a disability, YLDS. This slide shows an example of a co-benefit of policy intervention in Italy related to diet. The greatest co-benefit of improving diet in this case is the reduction of red meat consumption in men. This, if the consumption is reduced to the recommended 150 grams per week, which would be minus 73% compared to the current consumption, would bring 4.4% of death from colorectal cancer down, which can be avoided in men. The avoidable death rate in women is 3% instead. Similar reductions can be observed for cardiovascular deaths, again with the greatest benefits in men. There is also a role for public health in the climate change adaptation and mitigation actions. As we can see, the role is to reduce public health emission, defining roadmap and interventions, to promote and monitor mitigation actions with health co-benefits, to invest in sustainable infrastructure and technology, to train health personnel, to promote advocacy, and to advise leadership and governance. The role of public health in climate change adaptation and mitigation focuses on monitoring and assessment, which turns into facilitating policies, actions, and responses that are ultimately important for promotion, prevention, and training. It is noteworthy that measuring benefit solution, e.g. nature-based, is an integral part of the monitoring and assessment actions. The most important asset of any city is the health of its people, which is essential for fostering good livelihoods, building a productive workforce, creating resilient and vibrant communities, enabling mobility, promoting social interaction, and protecting vulnerable populations. Health needs to be thought as an essential input to the urban territorial planning process by means of contributing with health professional skills, expertise, and resources, bringing on board new partners and collaborations for urban territorial planning, using health lens to merge agendas such as climate change, providing health and well-being as an inspirational vision for a city, highlighting the links between health and urban territorial planning, provide a credible voice in advocacy for healthier urban territorial planning by identifying gaps in data to demonstrate the relationship between health and the built environment. And finally, to provide influence, evidence-informed decisions, track, monitor the success of their urban planning and its interventions. A health-driven approach can offer better coordination of effort towards the achievement of Sustainable Development Goal 3, the health goal. Many recent international documents have emphasized that access to greenery is to be regarded as a quality and health service. Moreover, the presence of greenery improves the aesthetic perception of the landscape and lends beauty to urban spaces, increasing property values and making neighborhoods more attractive. This slide summarizes the many effects of green and sustainable mobility, which we can list as such: improving physical fitness and perceived quality of the built environment, coolness, pollutant capture and air pollution reduction, and noise mitigation, attractiveness mobility, reduction in private car use, physical activity, reduction of sedentary lifestyle and promotion of healthy lifestyle, social control, security, and livability. So, working together, planning and public health can ensure that health promotion, disease prevention, and better health equity through good urban and territorial planning are central components to the communicable and non-communicable disease reduction and management response. Health needs to be thought as an outcome by means of different co-operating principles and strategies. These are listed here. Let's go through them. So reducing the burden of diseases and improving the access to healthcare. Helping to tackle the spatial and environmental causes of illnesses and health inequity. Raising level of health literacy, specifically via awareness of communities, politicians, and professionals, and of the upstream causes that result in adverse downstream health outcomes. Ensuring that health outcomes are considered commitments in the training of all built environment specialists. Also ensuring that territorial urban planning operates well, mitigating climate change and respecting relations to the land, and finally by helping to deliver national health plans such as those on non-communicable diseases. The strong reciprocal links that exist between urban territorial planning and health protection and supporting healthier lives, that is, health promotion, also provide a basis whereby many of the targets in Sustainable Development Goal 11, which is sustainable cities and communities, to support population health. The guidelines on urban and territorial planning aim to foster sustainable urban and territorial development through 5 qualifiers. Health has a role in each of these qualifiers as an outcome by means of supporting active mobility, public transport, and social interactions, and reduce the use of energy and resources. Supporting the well-being and resilience of vulnerable subpopulations, reducing inequalities, and ensuring adequate access to health. Facilitating better health through access to economic opportunities, amenities, and services, and finally, designing health benefits into nature-based solutions for ecosystem services, climate mitigation, and resilience. This all in the framework of a better integration of the evaluation of health impacts of urban environment interventions with the planning system. Urban green is a resource for health. As the picture shows, temperatures in cities rise up to 5 degrees higher than in sparsely or not at all populated green areas. Remember that plants, during the process of chlorophyll photosynthesis, can absorb 6 molecules of carbon dioxide and 6 molecules of water and transform them to produce 1 molecule of glucose and 6 molecules of oxygen. This activity depends on one main factor, the leaf area index, or LAI, which is a measure of leaf area per unit of area of soil. The higher the LAI, the more oxygen a plant produces. Among the plants with the highest LAI, which therefore emits the most oxygen, are firs, maples, beeches, and spruces. The least oxygen-rich ones are pines, and somewhere in between are oaks and poplars. Several factors can affect LAI, such as the size of the tree, whether it has many leaves, or whether it is evergreen or not. So urban green performs multiple functions in different contexts, from neighborhoods to cities to metropolitan areas. It directly affects the quality of life by providing reduction of heat and pollutants, availability of spaces for recreational and socializing and physical activities, as well as thermal insulation and energy savings. This image summarizes the beneficial actions of urban green as a health resource. It improves air quality, it promotes physical activity, it decreases stress symptoms, reduces noise, mitigates climate hazard, and it is beneficial to social cohesion. It has been proven by many studies that health mitigation interventions are effective on the following health outcomes, taking into account different temperature reduction scenarios. Number 1, the total and average annual reduction of death attributable to temperature reduction of 1.3 degrees Celsius of specific city average temperatures. Number 2, total and average annual reduction of death attributable to temperature reduction of 2 degrees Celsius of the specific city average temperature. 3, the total and average annual reduction of death attributable to temperature reduction of 1.3 and 2 degrees Celsius of the specific city average temperature. The sixth report of 2022 of the Intergovernmental Panel on Climate Change, IPCC, recommends the activation of a potential integration of various green and blue infrastructure strategies within an urban system. In the image, we can compare with different colors the effectiveness of the benefits of the mitigation actions and the co-benefits of the adaptation actions. Similarly, this slide summarizes the beneficial effects of urban forest and street trees, which provide the greatest mitigation benefits because of their ability to sequester and store carbon while simultaneously reducing building energy demand. Moreover, This slide shows that the sixth report of 2022 of the Intergovernmental Panel on Climate Change, IPCC, highlights the link between these benefits and the Sustainable Development Goals. The key points of this section are as follows. The assessment of mitigation benefits are dependent on context, scale, and spatial arrangement of each green infrastructure type in their proximity to buildings. Also, local implementations of urban green infrastructure can pursue inclusive, sustainable urban planning and the provision of safe, inclusive, and accessible green and public spaces for all. We are now at the conclusion of this presentation. The conclusions are, first, the importance of urban green infrastructure for reducing the total warming in urban areas due to its local cooling effect on temperature and its benefits for climate adaptation. Second, that urban green infrastructure involves the protection, sustainable management, and restoration of natural or modified ecosystems while simultaneously providing benefits for human well-being and biodiversity. The CNR team hopes that this presentation has provided an update on the topic of climate adaptation through fostering health perspectives in urban planning, which will be useful in designing urban territorial planning that is resilient to climate change and can protect the health of its residents. Thank you for your attention.